Come to the floor today to urge my colleagues to do everything we can to ensure that Obamacare is delayed. Like the gentleman from Indiana who just spoke, we know that this law is not ready for prime time. The president has delayed certain parts of it, a number of parts of it. The individual mandate has been delayed. If we're going to delay the individual mandate, it would make, the employer mandate, it makes sense to delay the individual mandate as well. I've introduced S 1490. This would delay by 1 year all provisions of the Affordable Care Act that are supposed to take effect on January 1, 2014 or later. In addition, it would suspend all taxes, including the tax on medical devices associated with the law for 1 year. I'm also a co-sponsor of the legislation introduced by Senator Coates, who just spoke, and the minority leader has offered this legislation as an amendment to the energy efficiency legislation that is on the floor now. It would also delay the individual and employer mandates for 1 year. Like my colleagues, I've opposed Obamacare from the beginning. I voted against this legislation time and time again. I think the count is 37 times in the House to repeal it. Obviously, I did not support it in the first place. But even the law's strong advocates agree that there are major issues with implementation under the current timeline, and that a positive, immediate next step for all Americans, I think, would be to delay this harmful law. January 1 of 2014 marks the rollout of some of the most fundamental parts of the law. CBO estimates that nearly 7 million people will join the individual exchanges that are scheduled to open for the enrollment period in less than 3 weeks. And all of our constituents will start feeling the pain if the law isn't ready from the outset. As I mentioned, even the president has conceded that the health care law is not ready by issuing a combination of waivers and delays for certain parts of the law. He did it for the employer mandate a while ago. If we do it for the employer mandate, as I said, it makes sense to do it for the individual mandate as well. Because of the delay on the employer mandate starting in 2014, many individuals will be using the honor system to verify their income and to whether they have access to affordable employer-provided health coverage. Without an appropriate verification system in place, individuals will have an incentive to report a lower income to receive more subsidies than they qualify for. This will ultimately raise the cost for everyone else. On the individual exchanges, just 2 weeks ago, HHS delayed the signing of final agreements for insurance plans that are going to be sold on the exchanges starting October 1. This comes on top of a report issued by GAO this past June, cautioning that the health care law could miss the October 1 open enrollment date because of missed deadlines and delays in several areas. The administration has also delayed the cap on out-of-pocket expenses that was intended to go into effect in 2014. If this weren't enough, there are also privacy and fraud concerns. There is great apprehension over the new federal navigators that are hired by the federal government to help individuals weed their way through the new paperwork and enrollment guidelines of the Affordable Care Act. These navigators receive no anti-fraud training, and the administration recently announced that the training for these individuals would be reduced from 30 to 20 hours. Further, these individuals will have access to consumers' private and personal data without having any minimum eligibility criteria or background checks. I could continue to list the pitfalls that this law has already faced, but the point is clear. The law is simply not ready for prime time. Implementing this law before it's ready will only force taxpayers into a system riddled with potential fraud, certain gridlock, and increased costs for all. As lawmakers, we have a responsibility to our constituents that if a law is not ready, we need to delay it for everyone. That's why I urge my colleagues to support the minority leader's amendment coming up on this legislation on the floor today and any other legislative vehicle to grant taxpayers a year delay for the Affordable Care Act and ensure the least harmful path forward. Simply put, I believe a total delay of Obamacare is the fairest way and the most realistic plan to prevent the law from wreaking havoc on all Americans.